Welcome to the New York Medicaid EHR Incentive Program Post-Payment Audit Education Series. The topic for this tutorial is Understanding the Audit Notification Email for a Meaningful Use Audit. This tutorial serves as a guide for eligible hospitals and eligible professionals participating in the New York Medicaid EHR Incentive Program who are preparing for an audit of their meaningful use activity. The intended audience includes providers, designated representatives, office administrators, vendors, and any individuals assisting in the audit process. This tutorial will explain the contents found in the audit notification email for a meaningful use audit and point out important information that should be noted. You can pause, rewind, and fast forward as needed. Keep in mind as you view the tutorials in this education series, the Office of the Medicaid Inspector General, or OMIG, is the organization that oversees post-payment audits for the New York Medicaid EHR Incentive Program. The Department of Health, or DOH, is the organization that administers the prepayment process. The two entities are independent of each other. OMIG auditors may ask for additional documentation that is not asked for during the prepayment process. Let's begin. The email begins by explaining that the purpose of the notification is to inform the provider that the Office of the Medicaid Inspector General, OMIG, recently sent an audit notification letter. The email goes on to note the name of the provider who is being audited and the activity being audited. In this example, the provider, Robert Doctor, is being audited for his 2014 Meaningful Use Attestation. If the provider has not received a hard copy of the audit notification letter or has any questions, he or she is instructed to contact the auditor, whose contact information can be found in both this email and the audit notification letter. The email goes on to explain that the provider is required to provide supporting documentation. The first documentation that is required is proof that appropriate certified electronic health record technology was utilized during the EHR reporting period. To show this, the email requests a signed vendor letter that clearly indicates the vendor name, product name, certification, and version numbers of the complete certified EHR systems, and the time period the systems were in use. In this example, our provider attested to a meaningful use EHR reporting period of March 2, 2014 through May 1, 2014. If the provider would like more information on meaningful use EHR reporting periods, the email provides a link to the tutorial Understanding Reporting Periods, which covers this topic. The next requirement is a completed patient volume Excel spreadsheet template. A copy of the patient volume spreadsheet template is attached to the audit notification email. You're requested to complete the spreadsheet and return an electronic copy to the auditor. The patient volume spreadsheet template must include all unique encounters that took place during the patient volume reporting period. For your reference, the email will note the provider's patient volume reporting period, number of Medicaid encounters, non-Medicaid encounters, and total encounters that the provider attested to. In this example, the provider's patient volume reporting period is October 3, 2013 through December 31, 2013. During that time, the provider attested to 360 Medicaid encounters and 640 non-Medicaid encounters for a total of 1,000 encounters. To download a copy of the patient volume spreadsheet template, click on the attachment. Click Download and save to a location on your computer that will be easy for you to find. For more information on completing the patient volume spreadsheet, see the tutorial entitled Completing the Medicaid Patient Volume Spreadsheet. It is available on the tutorials page of the EHR Incentive website at health.ny.gov/EHR. Moving on to the Meaningful Use Measures section, the email advises to refer to the attached attestation document. After reviewing the attestation document, the provider will need to submit documentation for the measures attested to. The list of appropriate documentation for each measure can be found at the link provided. It is only necessary to submit documentation for measures listed on the provider's attestation. The email goes on to note that the provider should submit screenshots, where applicable, of system functionality and reports. The screenshots must include the vendor logo, provider's name, and a visible date within the MU EHR reporting period. If a dated screenshot is unavailable, a vendor letter stating that the functionality was enabled during the entire MU EHR reporting period and could not be turned off may be submitted for consideration. For questions related to the public health objective, providers are advised to visit the public health section of the EHR website. The next section includes a chart where providers must explain any exclusions taken. In the left column, please list all exclusions attested to. In the right column, please provide an explanation of why each exclusion was taken. The provider in our example used an exclusion for e-prescribing and explained that he wrote less than 100 prescriptions during the EHR reporting period. The next section includes a chart to complete regarding service locations. In the left column, list the address for each location where the provider saw patients in an ambulatory setting during his or her EHR reporting period. In the middle column, enter the letter Y if that location was equipped with certified EHR technology during the EHR reporting period, and a letter N if not. In the right column, list the number of encounters, including both Medicaid and non-Medicaid encounters, at each location during the EHR reporting period. Include the exact number and do not estimate or round the numbers. In this example, in the left column, our provider entered the address of the 2 locations where he saw patients during the EHR reporting period. He then indicated that the first location was equipped with certified EHR technology during the EHR reporting period by entering a letter Y, and the second was not, by entering a letter N. He then entered that he had 1,004 patient encounters at the first location and 575 at the second. By entering this data, the provider has indicated that he saw 64% of his patient encounters at locations equipped with certified EHR technology during the EHR reporting period and therefore met the 50% requirement. So how is this percentage determined? In our example, the provider indicated he had 1,004 patient encounters at locations utilizing certified EHR technology during the EHR reporting period. This is the numerator for our equation. The provider indicated that he had an additional 575 encounters at locations not equipped with certified EHR technology during the EHR reporting period. This gives him a total of 1,579 patient encounters at all locations during the reporting period. This is the denominator for our equation. When the percentage is calculated, it equals 64%, which is enough for the provider to satisfy the 50% requirement. Please note all data must come from an auditable data source. During an audit, you may be asked for additional documentation. The next section includes a chart that needs to be completed to notate the unique patients whose records were stored in certified EHR technology during the EHR reporting period. In the left column, list each location where certified EHR technology was utilized during the EHR reporting period, as previously indicated with a Y in the chart in Section 5. In the middle column, enter the number of unique patients seen by the provider at that location during the EHR reporting period. In the right column, enter the number of unique patients seen by the provider during the reporting period whose records were stored in certified EHR technology during the EHR reporting period. It is possible that these two numbers will be the same if all patients at that location had their data stored in a certified EHR. Keep in mind, if a patient is seen by the provider more than once during the EHR reporting period, then that patient is only counted once for this measure. Just like the chart in the previous section, include the exact number and do not estimate or round the numbers. In this example, the provider practiced at 2 locations during the EHR reporting period. Only one of those locations was equipped with certified EHR technology during the EHR reporting period, as noted in the chart in Section 5. The provider entered only this location in the left column. He then entered the number 854 in the middle column, as this was the number of unique patients he saw at the location during the EHR reporting period. Of these 854 patients, 791 had records stored in a certified EHR during the EHR reporting period. He entered this number in the right column. In this example, the provider met the requirement that 80% of the unique patients seen at locations equipped with certified EHR technology during the EHR reporting period had their records stored in a certified EHR during that time. In this example, the provider entered 791 in the right column, and this becomes the numerator. He entered 854 in the middle column, and this becomes the denominator. When the percentage is calculated, it equals 93%. Please note all data must come from an auditable data source. During audit, you may be asked for additional documentation. The email goes on to explain you must submit the attached patient volume spreadsheet and all documentation requested in a secure HIPAA-compliant method. The preferred method is OMIG's Secure HIPAA-compliant Dropbox Hightail. Using the Hightail link found in this section of the email will ensure that confidential data is delivered securely and directly to the auditor assigned to the audit review. For more information on submitting documentation, review the Post-Payment Audit Education Series tutorial entitled Documentation Submission. Continuing on, the email explains that when the provider signed the attestation, he or she agreed to the statements, "I hereby agree to keep such records as are necessary to demonstrate that I met all Medicaid EHR incentive program requirements, and to furnish those records to the New York State DOH, Department of Health and Human Services, or contractor acting on their behalf, and failure to furnish subsequently requested information or documents will result in the issuance of an overpayment demand letter followed by recoupment proceedings." If the provider did not maintain all required documentation, consider the following. Did the provider work with New York City REACH or another agency to attest? If you worked with REACH, please visit their website, nyreach.org. Did the provider work with a group during the year under audit that may have had a certified EHR system? Is it possible that the provider used another certified EHR system during the year under audit? Can you contact the vendor that supplied the certified electronic health record system? Can you contact the billing company used to obtain patient volume? If you believe that you are unable to submit any of the required documentation, or if you have questions, reach out to the assigned auditor. The auditor's contact information can be found at the end of the email. You can reach out to the auditor with questions or for guidance about the audit process. Congratulations, you've completed the EHR Incentive Program Post-Payment Audit Education Series tutorial, Understanding the Audit Notification Email, Meaningful Use. If you have additional questions about your audit, please contact the assigned auditor. Thank you for viewing this tutorial. You can view additional educational resources by visiting health.ny.gov/EHR.